I am Dr. Holger Salazar. I am the latest addition to Stern. I joined Stern very recently. My background is as a cardiologist. I initially worked at Tulane University, where I was doing academic medicine, teaching medical residents and also fellows. So I love and enjoy teaching, so that's what I usually try to do with every single patient that comes to me. I think the most important thing for patients is to learn how to change their lifestyle. Unfortunately, once you suffer a cardiac disease or a heart problem, it is very difficult to try to solve the whole thing, but we have measurements that we can take to try to avoid the progression of diseases. And for healthy people, it's going to be very important to try to do preventive medicine, which is try especially to stop smoking, learn how to eat, usually do exercise, and very important always try to do that with your family. I think family is basically what is going to consolidate our society, and it's very important always to try to integrate your family in everything that you do. As a heart doctor, what I mostly do is to try to take care of patients, try to prevent diseases, and also I treat them. And among the diseases that I treat, usually I like to get involved with patients that have heart failure, patients that have heart blockages, patients that have valvular diseases, and also I enjoy very much taking care of patients with problems with cholesterol. Other things that I do, and I have a subspecialty training, is in imaging. Imaging basically is a very interesting tool that we use in patients for trying to diagnose and try to tell us the prognosis that a disease carries. For example, we have echocardiography, which is basically an ultrasound that we do like in ladies when they are pregnant. Instead of looking, of course, at the uterus, we look at the heart and we see the motion of the heart. We try to see if there's any problems with the valves. We try to see if there's any enlargement of the heart. We try to measure the function of the heart. And that gives us a lot of information as a very good screening tool for us in managing the patients. Also, I do nuclear cardiology, which is basically kind of a picture that we take through a CAT scanner, if you will, and we see there what is the amount of blood flow that the heart gets, and we can with that tell what is going to be the impact of the disease in the patient and also to try to assess the prognosis of the patients. Finally, I also do what's called a transesophageal echocardiogram, which is a kind of a weird name for a very simple procedure. We basically do an endoscopy, so we put a probe down the mouth and try to look at the heart from behind through the foot pipe. And this tells us a lot of information, especially in people with valvular diseases, and tries to inform especially the surgeon, if they have to do any surgery, what type of surgery they have to do and how they're going to be able to solve the problem. Finally, I'm also involved in doing vascular studies, in reading ultrasound of patients that have diseases in vessels going up the neck and trying to prevent them having strokes. Also looking at their legs and seeing if there is any blocks in the legs. And in aid with my colleagues over here who basically try to open up the arteries that go to the legs or to the brain, we can try to solve certain problems that sometimes cannot be solved by surgery. I think that at Stern we offer multiple type of studies, multiple type of aids to help the patients, and I think we're well trained for that, and we'll invite all of you to consider what we have over here to offer you. My final recommendation to you is try to feel part of the Stern family. When you come over here, you're welcome, and what we want to offer you is the best service that we can. If there's anything else that we can do for you, please feel free always to call us. Either you can reach us through the internet or you can call our office. Thank you.